This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the Health Radio Network. This is your host, Eric Michaels. Today's guest, once again, is Dr. Stephanie Teotia, a distinguished board-certified plastic and reconstructive surgeon based in Flower Mound, Texas, who serves the wider Dallas-Fort Worth area metroplex. Dr. Teotia lends her profound knowledge on the topic of cellulite and shares invaluable insights into the sought-after Aveli Cellulite treatment. She will explain what the Aveli treatment entails and how it is conducted, along with addressing the most frequent concerns raised by her patients. Discussion points will include the effectiveness of the treatment on different body types, the duration of results, considerations for individuals with varying skin conditions, and the impact of lifestyle factors on the effectiveness of the treatment. Join Dr. Teotia for an in-depth conversation on achieving and sustaining excellent results with Aveli Cellulite treatment. And Dr. Teotia, always great to have you with us on the program.
It's great to speak with you again, Eric.
Yeah, great to catch up with you once again. Certainly appreciate all that you offer here on the program. So for starters, and if you would, what is cellulite for those that aren't familiar, and how do you treat it?
Sure. Let's talk about cellulite. So cellulite is a benign but frustrating skin condition. It's characterized by rippled or dimpled skin texture on the buttocks and also the thighs. And people say to me all the time, what is this? What causes this? The depressions arise from fibrous bands of tissue known as septa, and they tether skin down and then emphasize the surrounding fat deposits. So the interesting thing about this, Eric, is really I only treat women for cellulite. So we know that it's caused by a combination of both genetic and hormonal factors. Additionally, weight gain and changes in skin laxity can influence the appearance of cellulite on women. So historically, physicians have been at a loss as to how to treat it. And today there are various treatment options that have been introduced to the market. There are some lasers out there, injections, but the non-surgical methods can have variable results and also require multiple sessions. So my practice addresses cellulite at its source by surgically releasing the bands responsible for the dimples. And for years, I performed a surgical procedure called Selfina. It freed the septal bands through tiny incisions at each dimple using a small vibrating blade. But now we're using Aveli. The big difference is that it reduces the appearance of cellulite on the buttocks and outer thighs by releasing the bands through often a single set of incisions. Both of these procedures have been and currently are being performed in my office. So this is performed using local anesthesia. The Selfina procedure was around for years, and we knew that 5 years after having the procedure, the cellulite looked much better. It was a long-term result. The Aveli is recently approved by the FDA. We anticipate a similar sort of result, but the data that the company has now shows that it works for at least a year.
Certainly appreciate your helpful feedback there, and a good place to kick things off here today. Now tell me, how does Aveli work, and is the treatment painful?
So as mentioned, Aveli targets the septal bands that are beneath the skin and essentially pulling down on the skin, causing the dimple. So this device uses a red light at the end in order to help locate and guide the device to the precise dimple, which then is released by the use of a sharp hook. The hook effectively captures the band while the blade clips the tissue. And before we even go into the minor OR in my exam room, I use all sorts of different lights in order to mark the cellulite. During the actual treatment, in addition to the local anesthesia, we provide different options for management of discomfort. One option is the use of Pronox, which is similar to laughing gas. Pronox is a 50-50 nitrous oxide and oxygen gas blend. And patients self-administer that during the treatment if they so desire. Some patients also use what we call a happy pill for the procedure to alleviate any anxiety as long as they have a driver. And honestly, pain is well controlled just with simple Tylenol.
Another question of curiosity here, I'm sure listeners would also have this question. Does Aveli take multiple sessions to see results?
The great news is no. It is designed to reduce the appearance of cellulite in only one session. Now, if you have more than 60 cellulite dimples, then treatment may be divided into 2 sessions. Um, and I think it's important for patients to realize that this tissue has been depressed for a long period of time and it has to go through a remodeling period. So we do have some patients who say 2 weeks after the procedure, oh my goodness, I can already tell like a significant difference, but that's not really the expectation. The expectation is that you start to see your result 3 months after the procedure, and then your final outcome is closer to 6 months to a year.
Always good to have you with us, Dr. Teotia. Some great information here. We're speaking with Dr. Stephanie Teotia, Distinguished Board Certified Plastic and Reconstructive Surgeon from Flower Mound, Texas, who serves patients in the Dallas area here on eHealth Radio's Plastic Surgery Information Channel, a part of the eHealth Radio Network. Now, continuing on, is there any downtime after this procedure, and how does one make sure the results last?
So patients expect bruising and swelling for about 2 weeks post-procedure. Patients go home after the procedure in compression, and I ask that they continue to use the compression during that 2-week duration. And patients really, there's not a lot of downtime. I tell them to take it easy for a day or two. Patients can walk as much as they like during the initial 2 weeks, but it's best if they're not in the gym during that time. But after the 2 weeks, they can get back to their normal physical activity. As far as the question as to how to maintain the results, well, keeping a stable weight never hurts. Being active and then protecting skin against the sun is best.
Certainly some helpful tips in those regards. And lastly, can Aveli treat anything else besides cellulite?
Aveli is only approved to treat patients' cellulite by releasing the septal bands. It does not address fat deposits or horizontal adhesions that are sometimes seen on the back of the thighs.
Once again, Dr. Teotia, we really do appreciate your visits with us here on the program and for what you do in this space. If you would, tell listeners where they can get more information on your practice and or be in touch as well.
Please give us a call, 214-823-9652. Otherwise, the website is drstephanieteotia.com.
And as always, listeners, draw your attention to the show notes where you can also have access to this link as well. Dr. Teotia, certainly appreciate your time and look forward to another conversation right here on eHealth Radio. Thanks so much.
Thank you, Eric. Please take care.
Hey, you too. Again, we've been speaking with Dr. Stephanie Teotia, Distinguished Board Certified Plastic and Reconstructive Surgeon from Flower Mound, Texas, who serves patients in the Dallas area. And for all the details, visit drstephanieteotia.com. And it says, been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.